This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week on the program, we're talking about Kratom. You may have seen Kratom in your local convenience store or smoke shop. Is it an herbal supplement? Is it a drug? Dr. Michael Sheehy is here today to help us sort it out. He is board certified in addiction medicine, and he's a fellow of the American Society for Addiction Medicine. Dr. Sheehy runs the John 317 Clinic, a service of KRMC, and he treats patients who are working to overcome addiction. Dr. Sheehy, welcome back. I want to talk about Kratom today. First, I know we should get the legalities out of the way.
Okay. And I just wanted to make some disclosures that I do not receive any funding from any pharmaceutical companies or any government agencies, and that the opinions that are expressed in this interview are mine, not that of Kingman Regional Medical Center or any of the authors from the source literatures that I've taken.
Important points. Let's begin with this. What is Kratom?
Well, in the simplest sense, it's an herbal supplement, okay? And it comes from a plant from basically Southeast Asia, Malaysia. In those places where it originates from, they usually use it as herbal tea, and they used it for things to combat fatigue, make them a little more productive, manage their pain. So that's kind of the background of it. Here in the United States and Europe, it tends to be more of just a over-the-counter supplement that is not regulated and doesn't have any true indications through the FDA, though there are some studies that talk about or looked into how it's used and some of the safety of it.
So Kratom is legal, it's accessible. Why are people using it?
People use it for a lot of different reasons. It can range from that they have some sort of chronic pain condition and that they find that it is a more effective pain medication, or I should say pain supplement for treating their chronic pain than, say, a pharmaceutical pain medication like oxycodone or Vicodin, because it's easily accessible. They can take it in many different formats, from a tea to capsules to smoking it. And then probably from my aspect, how I'm more involved in it is when people start to use it for other reasons besides treating their chronic pain. And that's when we're talking about either using it recreational or using it to treat a condition that was brought on by using recreational opioids. So, and it's kind of an interesting substance because at very low doses, it acts more like a stimulant. So it's more like caffeine, or on a more harder effect like amphetamines, so methamphetamine or just amphetamines. But if you take much higher doses, it's really much more of an opioid type substance. Now, if you're just using the regular Kratom that's either a capsule or leaf, the active ingredient, which is the 7-OH, is very low. It's less than 2% of the actual dried weight of the leaf. And that gets converted in our body to the active substance, and it's a very small amount. And so people will get the opioid effect, but they don't get a lot of the more dangerous effects of opioids, such as sedation, because it works slightly different on our body. But it does activate many other parts of our brain and receptors in our brain that may make it detrimental to them, because it affects ones that affect our blood pressure. It affects ones that have to do with serotonin, which has to do with our mood. So it can affect our mood and make us have depressive symptoms. It has the potential to actually induce symptoms of just abnormal dopamine levels, which is where things get to be a much more addictive substance. So that's generally how people interact with me when it comes to Kratom, is that they've been using it more recreational, or they attempted to use it to stop using another opioid, and they've now developed a tolerance and addiction to that. And then if they stop it, they're going to develop the same kind of withdrawal symptoms that they're going to experience as though they were taking a pharmaceutical opioid.
We know that people can overdose and die from opioids. And you said that at stronger doses, Kratom has a more powerful effect. Is overdose possible with Kratom?
So if it's just the pure leaf form, there is very low risk for overdose and death from it. It tends to be, because of the way it works, it affects the brain in a slightly different way than a straight pharmaceutical opioid. It doesn't affect the respiratory center as highly. It's also only a partial activator of the opioid receptor. So it's more along the lines of like buprenorphine, which is the medication we treat opioid use disorder with. So it doesn't turn it on all the way like a morphine or an oxycodone. When we see overdoses, it's unfortunately because this is not a regulated substance, and the manufacturers of it or even the people selling it sometimes will have other things in there that are now contaminated in. And some of the contaminants can be full opioids. It can be other toxins that we wouldn't expect them to be in there. There's been episodes of people getting salmonella because the leaves were contaminated with salmonella, and people got sick from that. The other times when people may end up having an overdose is if they mix it with some other substance that is sedating, such as a benzodiazepine like Xanax or Ativan, or they mix it with alcohol. The concern that the Drug Enforcement Agency has is when people are taking the concentrated form, where they have now removed the 7-OH, which is the active ingredients, and going from just 2% up to 80-90%. And then that level of that is much more likely to cause an overdose, have more addictive qualities to it, and lead to withdrawal and tolerance, and then that whole addiction cycle again.
Is that stronger concentrate available commercially, or do people have to do some chemistry work?
So it is still available. As of July of last year, the FDA had sent letters to multiple companies that were manufacturing it and said that this product is banned in the United States, and that it does not have any FDA approval, and it doesn't have any approval for as a food supplement of any sort. But unfortunately, there seems to be little, if any, enforcement. In preparation for my lecture, I just went on Amazon, and for $69, you can buy it. You'll get 5 tablets per pack. You get 20 packs for $69. So not advertising for them, but I just was surprised how easy it was to get. And then I did a little survey of our local smoke shops, and most of them, it is available there. So it's fairly easily obtained. Now, a lot of places it may be just the leaf, but there's still lots of places where that 7-OH is available.
People are using Kratom as an alternative or some kind of substitute for oxycodone and Vicodin, as you mentioned. But of course, those drugs require a prescription, and Kratom is its own entity. Can you foresee a time when this will require a prescription, or maybe it won't even be legal? I mean, it seems to be in a gray area right now.
It's definitely in a gray area. And, the leaf form, like I said, is considered a supplement, and it is still legal, and there's not really any other regulations other than the normal food supplement or dietary supplement regulations that the FDA have, which don't have a lot of regulation to them, other than just saying that these things haven't been evaluated by the FDA and don't treat or diagnose any disease.
Yeah. Sounds like the radio fine print, by the way.
Exactly, yeah. And that's what I put in there. But just last week, from the American the American Society of Addiction Medicine puts out articles that they think are important to addiction medicine, and there was an article from it was a city in Minnesota that they have now banned the sale of Kratom within the city limits, and there's a big movement among cities to now start banning smoke shops from selling it. I'm not sure how effective it will be for like very isolated cities to
Right.
just say, well, we're going to ban this, because it's obviously, you can just drive to some place that's not banned.
Yeah.
I think that definitely the 7-OH will probably see that one being highly regulated, because it's been scheduled as a Schedule 1, which means there's no medical use for it. It's highly addictive, whereas the Kratom supplement is now still unscheduled and just considered a supplement.
In my preparation for our chat, I did a little research online, and I saw a testimonial video with a guy who's a veteran, military veteran, and he was saying, Kratom is really important to me. I have back issues from my combat assignments, and now that I'm home and I'm stateside, I had some docs who wanted me to use opioids, and I'm really against using opioids, so I'm using Kratom, and it is much better. I guess what I'm wondering, can you see a legitimate use for Kratom?
Well, I think that there probably is some evidence that in the right patient for the right reason and using it in a way that's safe, it probably can be used. I think that there's not enough research for me to say that, and I don't think that the manufacturers of those products can say that yet. This is another example of I think that we need the research. I always tell my patients when I see them the first time, I'm not here to ban everything. I'm not here to tell you what to do, but I'm going to give you the information. And when it comes to Kratom, I don't think we have good information on it. I looked at the same website that you're talking about, and I agree. There's a lot of people on there that seem like they get a lot of help from it, and they're different than the people that I'm seeing and treating for Kratom, because they're probably using it as a supplement, and they're using it to treat their pain, whereas many of the people I'm seeing were using the concentrates, and they're either using it recreationally or they were initially treating their pain, and then they developed tolerance to it, and they developed the addictive principles to it, and then they really just could not stop it because they felt so terrible when they did stop it.
Yeah, of course, we'll respect your patient's privacy, but I was wondering to what extent you're seeing it and what patients are complaining of when they come in.
I surprisingly am not seeing it that much.
Yeah.
I only have a few patients that have it. I don't know if it's that they aren't aware of my services being available to them, whether it's also just the possibility that they look at it as this is a supplement. I don't need to see a doctor about it. We were kind of talking before we started that, Kratom is pretty easily obtained, and I'm not seeing a lot of patients with problems with it. So, I can't say, I don't have the numbers, but it leads me to believe that there probably is a large portion of people using it that aren't developing problems from it. So I'm not like one of these people who's going to say, absolutely, we got to get rid of this stuff. It's terrible. But I don't know the numbers, and maybe we'll see more down the road. Maybe after doing this talk, I'll have some people who realize that they could get treatment, I'm not sure on that one.
This is something that comes up often, I think, in your practice, and that is, Kratom is a plant. Kratom comes from a plant. It's all natural. It's going to be okay, right?
Yeah. Well, and, that is a common misconception about things. And I have a lot of patients, even before I practiced addiction medicine, that they really wanted to treat themselves with natural things. And I understand that. I don't want to put chemicals in my body, but what people don't understand is that plants that produce substances that we use either to treat something in a natural sense, it is still a chemical. And, nature is one of the best chemists, and there are many things that are highly toxic that is just in nature. I can give you an example of, there is a bead called the castor bead. They extract out of that a substance called ricin. It is a highly toxic substance that they use to kill spies, and it takes a tiny dose to kill a spy, and it literally is a natural product. You'll see them in foreign countries, tends to be South and Central America and in Mexico. They're really a pretty red bead, and they make necklaces out of them. So people who wear them are wearing a necklace made out of a poisonous bean.
Wow. Oh, nature is highly adept at killing human beings.
Yes, it is.
I understand from our conversation that there's not a lot of science. We don't have a whole lot of data on this so far. Is that fair to say?
Well, there's definitely more. When I did just a quick search of the medical research, there are hundreds of articles. Mm-hmm. So obviously I didn't review all of them. Many of them were in foreign languages, but there's lots of research. Unfortunately, they would probably be what I would call a lower quality study. Okay. And that doesn't mean that someone didn't work really hard to put them together, but there tend to be what we call a survey. So we go out, we find people that use this substance. We have a bank of questions we ask them, and they tell us their experience and what they have. Well, the problem with surveys is if the person perceives that your study may be negative to a substance that they find helpful, they may answer in a not that I think that they're lying, but they may have their answers biased towards what they want you to hear. So they're not always the best thing. Plus we have to worry about people's recall. Are these people who are using right now, and so they know the experience, or are these people who used in the past? So now they have to recall their experience. And then on top of that, their experience was with a substance that's mind altering. So does their, because one of the side effects of long-term use of any type of opioid activating things is cognitive impairment, loss of memory. So now we don't know whether those things are as good. This is something that would really benefit from someone doing real clinical work. And this would actually probably be easier to do than, say, cannabis research, because it's not illegal at the federal level. So someone could just actually find a bunch of people that want to use this and randomly select who gets the real stuff and the not real stuff, and sees what are the differences between those two groups. So it's doable. It's probably whether there's the interest to do it and someone to fund it.
Right. What do we know so far about long-term risks and dependence risk?
Well, I don't think that we have any true numbers on that, but I think that based on the fact that it is an opioid receptor, and that we know that when things are stimulating the opioid receptor, that people develop tolerance, and then they develop dependence on it. And so that's where the problem comes up, is we don't know that, but it just extrapolating what we know about opioids, it's highly likely. And even when some of the information provided, and it wasn't off their website, it was from a secondary site, the American Kratom Association did a survey of their own, and the survey was with over 8,000 people. More than 80% of their respondents said that they had decreased pain, increased energy, and loss of depressive mood with Kratom, but 49% stopped or reduced their use of prescription opioids, but they commonly reported nausea, constipation, so 13% nausea, 9% constipation, and 5% drowsiness or dizziness. They did say that the study identified that there was a dose-dependent relationship between benefit and adverse effects. So essentially, the higher their dosing got, the more adverse effects they got from it. There was a dose-dependent relationship between benefit and harm, meaning that as your dose went up, adverse effects also went up, and the benefits either stayed the same or actually decreased. I really think, like I said, I'm not totally against this. I think that there is probably some benefit to it. I think where people get into trouble is that they start using the concentrates. They're trying to wean themselves off something else. Because this is, I remember when this first came out, this was like the big thing. Like I saw it on the Today Show or something like that, where they were like, talking about Kratom and how great it was. And within that same story, they said, well, here's a person who died from it, but I don't remember what the reason that this person died. But, so the article was like, or the story was like parents saying how great it was that they got their kid off of opium or opioids. But then they also said, it's unregulated and there's all these problems with the substance itself. So, but I think that this is another example of like, it's a really great idea to try and find other substances to treat people's pain or even their addiction and withdrawal symptoms. But this is a complex disease that is difficult for me as a provider that specializes in addiction medicine to treat. And now people are trying to do this on their own with a substance that, depending on the source, may not be what they are actually looking for. It either may be a very low quality, very low dose, or it may be a very high dose. Depending on some of the places you get it, it may actually be mixed with opioids. In which case, if you're trying to get off opioids and you're just buying something that you think will get you off of opioids that contains contamination from opioids, well, then you're really just back to where we are. So
I don't know if this is appropriate, but listening to the description, I sort of feel like, is Kratom, does it have a value? Maybe it depends on where it is in your life cycle with drug use. If you're trying to get off of something stronger, perhaps it can stand in. Whereas if we're talking about a young person who's just getting momentum experimenting with drugs, perhaps this is a springboard. Perhaps this is not a good idea.
Yeah. I think that's probably a good way of saying it, that there are probably some benefits to it and there's some dangers to it, and it's probably going to depend exactly where you are in that cycle. If you're someone who is experimenting with it and find it's pleasurable for you and you're seeking out the more concentrated ones, you're probably setting yourself up for an addiction. And because it's considered natural, well, then that
what could go wrong?
What could go wrong? Exactly. And if you think about it, well, there are things like opium. That's a naturally occurring product from a plant that we make all our naturally occurring opioids from, such as morphine and heroin. So those, there's no free ride, unfortunately.
Dr. Sheehy, you and I are both part of a group called MSTEP, that's Mojave Substance Abuse Treatment and Education Prevention Partnership. And we get together once a month and we hear from people of all different disciplines. So medical professionals, people in law enforcement, teachers, people in corrections, people in courts, and we talk about the many ways in which we're trying to address drug use, drug abuse here in the community. And, I'm thinking about Kratom. I'm just thinking about the big picture of what you do as well. Do you see young folks or your clients, are they primarily adults?
In my outpatient practice, I don't see children. In the hospital, if they consult me, I will see anyone over the age of 12. Yeah. I fortunately have only ever actually seen one person below the age of 18. Yeah. The majority of my patients actually are probably, I hate to use the term because I'm in there, is middle age.
Yeah.
Okay. So most of my patients are in their late 30s, 40s, and early 50s. And, that tends to be the time when people start to realize that their substance use is affecting their life or has affected their life in a way that's so detrimental that they realize that they're not going to get where they want to be without some help. And so I think that's why I see a lot of folks in that age range. It really also kind of varies on the substance as well.
Yeah. The people who come in, last time we talked, you made a point of saying you're not doing counseling, you're doing medical therapy. Could you talk a little bit about what a visit with you might entail?
So, as I've said before, my outpatient practice is by telehealth only. So, generally, a first appointment, we're going to talk for about an hour. I always ask patients to try to find a place that's going to be private and quiet, and that they got their phone plugged in so that they don't run out of juice on their phone. And it's really letting them tell me, where they've been with their substances, how they got there, what have they done in the past to get treatment, and what are their goals? Because for some people, especially with alcohol, their goal is oftentimes is I just want to drink less. There are other people who realize pretty quickly after they start getting treatment that less is not going to be effective. They have to stop completely. So that's really what I'm trying to do. I want to hear what they have to say. I want to hear what they've done and what their plans are, and then I help facilitate that for them. I always kind of start off my appointments with, I'm not here to tell you what to do. I'm not going to babysit you. I don't get mad if you have a return to use. It means that we just need to talk and figure out what's the next step, because maybe it's that I'm not doing a good job that you're having a return to use. So it's not the old school, you got to be better before you see me. You got to do what I say, and you got to do it my way, or I don't want to see you.
I've talked with a lot of folks lately about addiction. I hear a lot of talk from medical professionals about meeting people where they are.
Yes.
And that sounds like what you're saying.
Yes.
Is the goal of drinking less, of taking less, is that tenable, or do people really have to quit?
There are some people who they recognize that they need to drink less, and there's been lots of studies that show that if you drink less, you get a health benefit from it. They now have discovered it's not so much they've discovered, it's just they've really looked at what's already there, and we don't feel that there's any safe level of alcohol at this point. The old thing where they used to say 2 glasses of wine was beneficial. Well, really what they discovered was, when they looked at the data again, is that the people who drink 2 glasses of wine per day tended to be just people who had healthier lifestyles. Not always. I mean, there's probably some people that, they have that French model where it's like they can smoke, they eat a French diet and drink wine every day, and they live to 100. But that's more genes than anything.
Yeah. And walking a lot.
Yes, and they walk a lot.
Yeah.
Yes.
On the way over, it's just a remarkable coincidence for me, but on the way over, I stopped at a business here in town, and I overheard 2 employees talking. And in my defense, I was not eavesdropping. It wasn't private. They were right in front of me. And one said his brother recently overdosed and died. And the guy saying this was a young guy, right? And he said it was my baby brother. So I can only conclude this was definitely a young guy who died. So his friend commiserated, "Oh, I'm sorry, that's too bad." And he said, "It's killing my mom too." And he kind of shrugged and said, after a while, you just expect it.
Yeah.
For people who are caught in this cycle of addiction, I guess what I want to say is, it surprised me how fatalistic he was about saying that.
I think that why we see that now is because it has become so common. I mean, we finally are starting to see a drop off in that overdose death rate. But just 2-3 years ago, I mean, we had over 100,000 people die of drug overdoses. Most of them were opioids or combination of opioids with other things. Yeah. That surpassed trauma deaths. I mean, as someone who practiced emergency medicine for 25 years, it's amazing to think that something could ever overtake trauma, because trauma is hard to control for, because there's so many variables that lead to like a car accident or to someone getting injured at work that leads to a death. Whereas like drug overdoses, I mean, it just boggles my mind to think that many people have died. And so I think it's just become so common, just like we've talked about school shootings. We just see it, we acknowledge it, but then we move on because it's just become the same thing every day. And so we just don't want to dwell on it because it's just common.
We start to become inured to it.
Yeah.
For patients who are struggling with addiction, or maybe for someone who's listening and has someone close, a friend or family member who's struggling, what is something you would want that person to know about the first steps toward getting healthy, getting over that?
Well, what I would tell them is that there is treatment available, and that many people who enter treatment, even if it's not successful in the first time, if they continue to engage in treatment, can regain their control of their life and be successful and healed from this chronic illness. I mean, this is a chronic disease, and it is not because of something they've done. It's not a moral failure. This is your brain being changed by a substance, and once that change has happened, it has so much control over these people. But we have medications that can help you regain that control, and it's available, and it is available more than you probably think, and it's not hard to obtain. You just have to make that. You have to make that step, and you have to make that phone call.
One last question, and I think we may have covered this in our first conversation. I want to ask you again. I did a little research. According to the National Institutes of Health, relapse is very common. It's between 40 and 60%, according to their numbers. Mm-hmm. So I'm wondering, and we know that, right? It takes a while, oftentimes, for patients. How do you, as a doctor who specializes in addiction medicine, how do you measure success?
Well, first of all, I don't use the term relapse. I use the term return to use.
Return to use, okay.
Relapse kind of has a pejorative,
sure.
Negative connotations to it.
The literature, I think, still says...
Yes, it does.
Okay,
it does.
all right.
But in our specialty,
okay.
And I wasn't correcting you.
Correct me, but in my defense.
That was not a correction. This was because I want people to understand that, especially if they're going through this and they have a return to use. You hear the word relapse, and you think of every movie, TV story, whatever.
Absolutely.
This is the person that is now in the gutter.
Yep.
And
you're right.
That doesn't have to happen. There are times that people are going to have a return to use, but just because you have a return to use does not mean that you failed your treatment. And when someone that I'm taking care of has a return to use, we talk about it. I always stress with my patients on their first appointment, really every appointment, like what's going to help them and me to help them is that they need to be honest with me. I'm not their parent. I've already said I'm not going to get mad at them. It will take a lot for this person, a patient of mine, to do something that I'm going to fire them as a patient. And it's usually going to be something that they're doing that's illegal when it comes to medications. Other than that, I will work with them and try and figure out what we need to do to help them with that return of use. Is it that the medicine's not working? Is the medicine not a high enough dose? Do they need a different medicine? Do they need counseling? Do they need to get out of the living situation that they're in because maybe everybody else in that situation is using, or they're homeless and they need to use whatever the substance is to survive? Because there's a lot of times when a person is homeless that the only way they're going to survive is staying awake for a really long time. Yeah.
Well, you emphasized that you weren't correcting me, but I appreciate the note because language is important. And language is important. I'll leave it at that, right? Because that's a whole other conversation on semantics.
Sure.
But understanding that return to use is common, and understanding that oftentimes you have to play the long game in this.
Yes.
I want to ask you again how you measure when you're working with an individual patient. How do you measure success?
Okay. How do I measure success? So, I kind of let the patient tell me what's success for them. So, for example, I had a patient that was sent to me. She wanted to have a surgery. The surgeon wouldn't do surgery on her as long as she was using substances. So her goal was, I want to have this surgery. She had an ostomy and she wanted it reversed. He would not reverse it until she was off and stable. So that was her goal. And we got her stable for 6 months. She had her surgery. She followed up with me 2 more times. She said, thank you very much. I have what I need.
Easy.
And so unfortunately, I'm pretty sure she went back to using. I never saw her again.
Yeah.
But it's really up to the patient, because like I can't tell them what their goal is. For me, what I would like the goal to always be would be, of course, to be where they're not using substances and that they're having the life that they want, but maybe it's where they're now stable on whatever substance they're using. They're able to have a job, interact with their family. If their kids have been taken from them, have their kids back. It really is a different thing for every person, because every person's substance use is different and how their story is affected by it.
That is Dr. Michael Sheehy. He is board certified in addiction medicine, and he's a fellow of the American Society for Addiction Medicine. He runs the John 317 Clinic, and he sees patients here at Kingman Regional Medical Center. You can reach Dr. Sheehy at 928-352-1270. That's 352-1270. Or via email at john317clinic@gmail.com. Dr. Sheehy, thank you so much for your time today.
Thank you.
And that is the program. That's another edition of Focus on Your Health. I'm TG LaFredo, and thank you for listening. We'll catch you next time.